You are listening to The Scope, Phelps Health Podcast, Episode 10. Today we're discussing summer safety. Let's get started. Hi everybody, I'm your host, Paige Heitman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or subscribe to our YouTube channel. You can also follow Phelps Health on Twitter, Instagram, LinkedIn, and Facebook. All links are in the show notes. Let's get into the show. Today our guest is Dr. Nathan Ratchford, Chief Medical Officer of Phelps Health Hospital and a gynecologist with Phelps Health Medical Group. Welcome to our show today.
Thanks for having me.
Yeah, no problem. We're really excited to have you here. So before we get into our show, go ahead and tell us a little bit about yourself.
Sure. So I've been in Raleigh now for 12 years. I'm trained as an OBGYN, and for the past 4 years I've done gynecology only. And for the past 2 years I've been the Chief Medical Officer at Phelps Health for the hospital.
So 12 years, where were you at previously?
So I don't know how far back you want to go, but born and raised in Missouri. I've been here all my life. I went to college at Drury in Springfield, and I went to medical school at University of Missouri in Columbia. And then I did my training as an OBGYN at what was then called St. John's in St. Louis prior to coming here.
Oh, that's awesome. So how have you enjoyed your past 12 years with Phelps Health? Oh,
it's been great. So, my wife and I, we have 2 kids, and we both grew up in small towns. And, as an OBGYN, there's kind of a limit to how small of an area you can go to. So we didn't want to go to, a super rural area, but we didn't want to stay in like a metropolitan area either. Mm-hmm. So Raleigh's been great for us.
That's awesome. Yeah, I always think Raleigh is kind of a nice mix because you can get to Springfield or St. Louis in like an hour and a half.
Oh, sure.
So it's really nice.
Yeah, definitely. It has a lot of stuff here for families and kids. Mm-hmm. And, if there is something that you're looking for that you can't get here, like airports, sports, things like that, mm-hmm. St. Louis is not that far away. So
that's true. That's
really
a great point.
Well.
Mm-hmm.
Yeah.
So why did you choose to work at Phelps Health?
So when I was looking at places to work after my 3rd year residency, so OBGYN takes 4 years, so most people start looking sometime in their 3rd year. I was like I said, I was looking for smaller areas, but I wanted to be close to family. Mm-hmm. So my family is down in the Joplin area. My wife's family is in Southern Illinois, and we had this region that we were looking mm-hmm. at that kind of fit what our needs were and what we were looking for. And at the time that I was finishing training, Raleigh was looking for an OBGYN, and it worked out well. We're smack dab between the grandparents for the grandkids, so it works out really well.
Oh, that's awesome. Do you feel like Phelps Health kind of fits those needs for you personally?
Oh, definitely. The entire time I've been here, just the staff at Phelps Health, the administration at Phelps Health, the patients in our community, it's been such a good fit.
So we're going to go ahead and get into our show and talk a little bit about some summer safety. So we know that summer's in full swing, but we can't really forget about COVID-19. We're doing a lot of gatherings and really fun events, but summer's going to look a little bit different due to COVID-19 and a lot of restrictions and guidelines that are still in place. So as we get out and about this summer, are we still at risk for contracting COVID-19?
Oh, sure. It happens every year. Summer brings with it a whole new set of circumstances mm-hmm. and safety issues that people have on their mind, like, with the weather and sun protection and dehydration and things like that. But now, here we are in June of 2020, and we've got the COVID-19 pandemic on top of all that. Mm-hmm. I sympathize with people. It's been around for a while now. It's a politically heated argument. There's different guidelines from different organizations, so it's hard for people to know what the right thing to do is. So I'm glad that people are thinking about this and they're asking what the right thing to do is. Fortunately for summer activities, a lot of what you do is outside, mm-hmm. which goes a long ways to helping with reducing transmission. But that doesn't mean that people can, just throw off caution and mm-hmm. do what they normally would do. They still need to, practice safe measures like frequent hand washing, social distancing, wearing a mask when they're in public, things like that.
Because viruses don't die during summer, right?
Sure. So definitely some viruses are decreased in the warmer temperatures. So, a great example is the flu season. We always see a surge of influenza in the colder months here in Missouri. But, viruses behave differently, and there's some viruses that are always here. And honestly, the COVID-19 virus is just too new. We don't know how it's going to behave. So,
and we still have spikes.
Yeah, so hopefully it, being in the summer is going to help it, but we'll have to just wait and see.
Yeah, because like you said, there's still a lot that we don't know, and as people get out, people go to bars and they get too close to each other, and then we have all these new surges.
Yeah, no, I think here we are just a few weeks past Memorial Day weekend, and I think everybody saw in the news there were a lot of people that were doing activities that may not have been in their best interest, and fortunately, here we are 3 weeks after all that. We're not seeing a huge surge in our area, but since this all started, we've yet to see a slowdown in the increase in new cases.
Which should tell people that they still need to be cautious.
Yeah,
right?
Absolutely.
So I'm going to have to read this next one for you.
Yeah.
It's from Ohio State University. So they recently stated on an NPR article that we can think of transmission risk as time, space, people, and place. Is that true that the more time someone spends in a closer space to any infected people or persons, the higher the risk is going to be?
Oh, definitely. That's a good summary of how the virus is transmitted. So the longer you're around somebody that could be infectious, the closer you are to them. If it's in an enclosed room rather than being in the outdoors where there's a lot of wind and air changes and volume to kind of dilute the virus, those things all play into how contagious somebody might be and how that virus gets transmitted.
So indoor spaces are a little bit more riskier to be in then?
Oh, definitely. Yeah, the more enclosed the space is, the less likely that air is to be circulated, and that's how the virus is transmitted, is through respiratory droplets. So, talking, coughing, sneezing, singing, these all put more virus out in the air, and in an enclosed space, there's less ability for that air to not be contaminated. So if you're outside, the wind's blowing, there's more volume of air, those things all help.
So you said singing, and that immediately made me think of religious worship services. So can people start attending religious services if their place of worship is offering it, or should they still be very cautious about doing so?
Yeah, I think that with our current level of prevalence in the area, which is very low, I think that it's safe for churches to open up with reasonable precautions. So, like I know some churches are doing like a limited number of people in the pews. They have to space themselves out. They're even like scheduling additional services and things like that. I think in our current setting, I think that makes sense. Like what we've had to deal with at Phelps Health ever since the beginning of this is an evolving situation. So, here we are. We might be saying something different next week. So, but no, I think that's reasonable.
What about like backyard gatherings with like a small group of friends? Is that considered high risk because they aren't my immediate family members? And should they like have to wear a mask to come and hang out with me?
Sure. I mean, it's gonna depend on the details, obviously. If you were gonna have friends and family over for some event like that, being outdoors definitely helps, like what we mentioned. You want to really make sure that whoever your visitors are, that they're not sick, they're not potentially bringing something to you. So, I think it's a good opportunity for you to be open and honest with your friends about, hey, I really want to see you and have this event together, but if you think you might have this or be sick, I'd rather you not come. I mean, it's just common sense. So
yeah, just trying to be smart. I recently went to the eye doctor, and I was incredibly impressed with their check-in process, and Phelps Health is a lot like this. Whenever you go to check in now, you have like a document that you have to fill out to say, do you have any of these like coronavirus symptoms? And it's almost like, should I do that with my friends? Maybe.
Yeah, I mean, you know, I think right now when patients come to healthcare facilities, they expect that. You know, we've all kind of gotten used to, hey, I want to go see my doctor. For that to be safe, I've got to go through these screening areas, there's hand sanitizer everywhere. You see everybody wearing a mask inside the hospitals. I'm not saying you should necessarily do all of those things in your backyard, but I don't think it's imprudent to think that way.
Yeah, you shouldn't throw caution to the wind.
Yeah, you want to protect yourself, your family, your friends. You know, you should be thinking these things to help reduce your exposure.
Yeah, don't just think about it whenever you go to the doctors. Think about it to take care of other people too.
Right.
So what about restaurants? I know they've opened back up too. Can I sit inside? Is that unsafe? Should I ask for outside seating? What's your best advice?
Yeah, restaurants are a tricky one because not only are you in an enclosed space with not just your immediate family, but there might be other families in the same area. You're all eating, you know, you can't eat with a mask on, and you're all, I'm sure you're talking, you're socializing. So, you know, restaurants pose a different set of circumstances than what we were talking about earlier with the backyard gathering, obviously. So, you know, I would say if somebody's going to go to a restaurant, if they can like preferentially eat outdoors, if they can limit their time in the restaurant, you know, rather than go out with your family and friends and you know, a meal becomes an hour or 2 or 3. I think right now that's probably not the best thing. But again, I think that the prevalence of the virus in our area is so low that as long as people are smart about it, I think that that's reasonable to go to restaurants.
Why do you think the prevalence of the virus is so low in our area?
Well, I think there's a few different things that factor into that. So probably the biggest thing for being in central Missouri is that since we're not in these metropolitan areas, high-rise buildings, elevators everywhere, things like that, there just wasn't a lot of opportunity for the virus to spread quickly like what you see in areas like New York. I think the second thing is, again, political, but I think the second thing is that we did a lot of things early on to try to flatten that curve and reduce transmission, and I honestly believe it worked. So, you know, as testing has become more available, as we've secured appropriate PPE like masks and hand sanitizers and things like that, I think it's reasonable to start pulling back on a lot of these restrictions as long as we're careful and we're smart about it.
Yeah, we don't just go straight gung-ho and everything's open and it's kind of like a free willy thing.
Right, and I get it. I'm tired of wearing a mask everywhere, just like everyone else is. I totally understand people's preference to not do those things, but I'm just leery of if we do too much too soon without being smart about it. I'm afraid that we're just going to put fuel on this fire.
Yeah. You know, Ed Clayton, our CEO, says this really well. He always takes things 2 weeks at a time, which you said it well earlier too. What we're doing this week may not be prevalent to whatever we're doing next week.
Yeah,
next week, our whole marketing campaign may change. We may have the tent completely up and running at full scale again.
Yeah,
we don't know how this is going to work.
If you went back to late March, early April, we were having conversations daily preparing for the things that you saw play out in New York, and thankfully that did not come true, but who's to say that it might not turn out to be that way eventually? We just got to stay vigilant and try to make good decisions.
Yeah, and it's good that we now have a playbook ready in advance for it.
That's right.
Instead of kind of running off the skin of our teeth to try to figure out what to do.
Yeah, I mean, not that people like these things, but now that we know what it's like to postpone appointments, postpone elective surgeries, have patients go through the triage shed, as we start to back off of these things and go back to what we consider normal again, if unfortunately we were to find ourselves in a situation where prevalence was increasing quickly, it would be easier for us to roll those things back out because we know what that looks like.
So something else that I thought was really, really cool about summer activities is that pools and beaches and stuff like that are very low risk.
Mm-hmm.
Can you talk to that?
Yeah, again, the virus is transmitted mainly by respiratory droplets, so the ability for it to spread through like the water in the pool is really low, and typically pools have a lot of like additives and chemicals and things like that to cut down on transmission of diseases anyway, so that really helps. But again, the key is being outdoors, and that air volume being changed over, it just really decreases the risk of transmission.
What about people traveling like out of state or to larger cities right now? Should they take any like sanitary kits with them? Like, should they make sure that they bring wipes, or should they not go to those events? Like, what if it's a wedding?
Sure. Yeah, it's tricky to put all of that into one category. It's not so much the distance that you're traveling, it's where you're going and what you're going to be doing. So, if you were going to travel to a place with a high prevalence, so, right now you'd be looking at like places in Arkansas, Michigan, Oklahoma, Arizona. You could go to specific places in those areas and probably be totally fine depending on what you were doing. You could also go to more metropolitan areas with, a high prevalence of the COVID-19 virus. And if you were, like you mentioned, a wedding, for example, or, a birthday party or something like that, you're in a small space, there's lots of people around, they're talking, they're eating, they're singing. The more you add these things in, the higher your risk of being exposed goes up.
So we just have to be very careful about what event am I going to, and is it high risk? We have to ask ourselves those questions before we decide to partake in any of them.
Sure, that's very true.
Yeah, that's great advice. So can people still go on vacation with those same ideas in mind? Yeah,
I would think the same thing would apply. I think around here a lot of people, when they think of vacation, are thinking about taking like a plane ride somewhere really far away. Planes, I know that they've done a lot of things with that, looking at transmission and taking precautions. So, again, I think if people are being smart about where they're going, how they're traveling, what kind of things they're doing, I think that these are reasonable things to consider. But again, it all goes back to, the prevalence, how much virus is around here and in the area you're going to, what kind of things you're doing, that kind of stuff.
So what are some activities that you think we should be sure to wear our masks for?
So me personally, there's different recommendations if you look at like the CDC or WHO, things like that. I still feel like if I'm going out into a public place, like if I'm going to the store or something like that, I think the right thing for me to do is to wear a mask. My situation is a little special because I'm working in a healthcare facility, and I also have a family member that might have immune issues, so I want to take extra precautions, and I think that's very reasonable. As you look at certain activities that you're wanting to do, like we've talked about, like parties and restaurants and weddings and church and things like that, I think it's important that you follow the guidelines that are in place at that time. And I've noticed that all of these, restaurants and churches and things like that in our community, they've really tried hard to do what they feel like is best for their patrons. So I would encourage people to follow those.
Yeah, I know some of the restaurants or different places that you go to, they'll wear a mask and have gloves, and you have paper menus, and you have like plastic forks and stuff.
Yeah.
It's really cool the amount of effort that they've placed into safety for everybody.
Yeah, and I understand that when you see that stuff, it looks very foreign. And I've had patients just even this week in the office talk about how seeing these things is very anxiety provoking, for example. But I think we're trying to do the best with the situation that we find ourselves in, and I expect it to be temporary. As we go farther along into this, we're going to learn more. Hopefully, in the not too distant future, we'll have a vaccine. Our testing abilities, it's getting better and better every week. So, I think as long as we cooperate, work together, and
You laugh because sometimes that's hard to do, isn't it?
You see it in the news all the time. I mean, I think that it's important that people, they're smart and they're safe about this and they follow the guidelines.
So let me have you debunk a myth for me or prove its accuracy with masks. Should people, whenever they are in their vehicle by themselves, wear a mask?
No, I mean, generally if you're by yourself in an office setting or your vehicle or your home, a mask is really not going to benefit you or anybody else. You know, really the main advantage of wearing a mask is if you are potentially contagious, whether you know it or not, you're not going to expose somebody else. So as long as you're not in that situation, a mask is not really that beneficial.
Perfect. So I have one more question and then we'll kind of wrap up our show. So can you provide just some general safety tips that apply to everyone regardless of COVID-19? Because we're in the summer season, like make sure to wear sunscreen. If you're going hiking, what are some things to make sure you have with you?
Oh, sure. Yeah, I mean, you know, in the summertime, it's always important to stay hydrated. So you want to definitely be drinking water and don't get dehydrated. If you're going to be outdoors, exposure to sun, that's a big risk. Sunscreen, long sleeve clothing, hats that are appropriate. Around here, if you're going to go out and like hiking and stuff like that, especially if you're going by yourself, make sure somebody knows where you're going and when to expect you back, those kind of things. You know, alcohol, that's a common thing with outdoor activities. Definitely want to be in moderation and be safe as far as that goes. Another big one around here is like exposure to like tick bites and things like that. So, you know, definitely be wearing tick repellent and be watching for things like that. But, you know, like you said, in addition to the coronavirus, those things don't go away. So on top of all that, frequent hand washing, wearing a mask where it's appropriate, social distancing, that all goes with that.
So because we're nearing the end of our show, I do want to go ahead and give you an opportunity to speak to our listeners and share any final thoughts that you have regarding summer safety.
Sure. No, I think, I don't know if this ties directly to safety, but as I was kind of thinking about this conversation, you know, I want people to still have fun. I want people to do normal activities, see their families and enjoy this time of the year, but they got to do it in a safe and smart way. So that would be my advice.
Yeah, I think we all needed to hear that. So go out and have fun, and thanks for tuning into The Scope. If you liked our show and want to learn more, check out phelpshealth.org.